So welcome everybody to Microshare's webinar. We've got folks joining us from North America and Europe today. And it occurs to me that we're in a unique moment in modern history where we're all doing the same thing. No matter where we seem to be right now, we're self-isolating and we are trying to stay healthy. So I hope that the content of today's webinar is relevant for the new world and what we're thinking about today. So my name's Ron Rock. I am the co-founder and CEO of Microshare. I've spent most of my life in large corporate regulated industries, financial services, healthcare, and insurance. And I've spent most of my career thinking about data, large scale data, resiliency, storage, how to share it. And with that, we've started Microshare and focusing on IoT. Mike?
Yes, well, I wanted to just welcome everybody as well, and thank you for that introduction, Ron. I've had a career that is oddly shaped me for this moment. I was a risk consultant at a firm called Control Risks, and then spent a good deal of time in financial services before that, and then was a BBC, MSNBC correspondent for a period in my life. Now, you know, I've gotten deeply into adding the sustainability aspect to the risk part of my portfolio, and it has been a very good fit for Microshare, and we're very excited to give you a sense of just, you know, how we feel the things we've been pursuing in the past 2 years are so relevant right now. For instance, infection risk mitigation is something we've been doing for a couple of years now, and all of a sudden everybody realizes the value of it, particularly in commercial real estate and healthcare. So Ron, you want to take it from here and we'll start the content.
Sure. So a little bit about Microshare, who we are. Next slide, Mike. So we are a digital twinning IoT data solution and platform. What is digital twinning? At the highest level, it's simple. It's creating a virtual replica of our physical world. Virtually every part of our world will have a virtual replica. Our bodies, our homes, our cars, our cities, our buildings. Why do we do this? There's really two primary reasons. We do it because we're going to be able to drive efficiencies out of all of our physical assets. We're going to get better at how to manage them, how to make them more efficient, how to reduce our carbon footprint, how to create cost savings. But the other reason we do it is it's going to create new opportunities, new insights, new business opportunities. So companies like Microshare exist because of this digital twinning and IoT ecosystem. In IoT, it's about putting sensors on everything. And for Microshare, we bring a common approach to lots of different kinds of sensors for physical buildings, hospitals and commercial buildings and airports, lots of different pre-packaged solutions that make it easy for clients to buy and implement these solutions at scale. Over the last 7 years, our global partners include companies like Microsoft, Arrow, and Semtech. We're heavily involved in the LoRa Alliance, which is the fastest growing IoT network in the world. And as Mike pointed out, our focus on infection reduction and cleanliness and workplace well-being predates the current crisis. And we've been working with a lot of large hospitals in Europe primarily, and beginning here in the US, to start making these solutions available in this world where we think it's much more relevant. So in this webinar, Mike, next slide. So we're just going to talk a little bit about the COVID-19 virus and where we are about that. We're then going to talk about its impact on commercial real estate. We're going to talk about the ROI and the value of the data. And then we're also going to specifically tell you some of the things we're doing in healthcare. So with that, Mike.
Well, let's start with a bit of housekeeping. I probably should have mentioned up top. We are going to take Q&A at about 45 after. If you want to submit a question, the chat feature is the place to do it. And we have somebody keeping this for us who will collect those questions, and we will get to them at 45 after. But let's kick off with a word about where we are with COVID-19. Obviously, we're not going to spend a lot of time on this. This is the front page and a lead item in every news report for the last 2 weeks. But it is completely unprecedented and stunning, the extent to which this is affecting everyone. There is no sector, there is no country that can ignore this. And you all know that, and I'm not going to belabor it. We are actually in the United States on a very heavy trajectory of new cases. That's not a good bit of news, but we hope that, obviously, as Nietzsche once said, what doesn't kill you makes you stronger. And I hope everyone will be healthy, and I hope we will come out of this and take the steps needed to make us stronger. What we're looking at right now, of course, is this incredible, really full stop of the US and global economy. Things are just stopping. It's unprecedented. Normally a recession, as you can see in that first chart, a recession takes some time. The Dow or the S&P will go down slowly. This recession just began on a Tuesday, just making that up. But in essence, we don't have any real precedent for how to gauge how this affects the economy in the long term. There is some hope that it's a short-term thing. That could be. But what we feel is that it's important right now to look at this through the lens, particularly for commercial real estate, through the lens of all the new questions that it's raised. This is not even if it's a V-shaped recession, this is not a question of going right back to business as usual. There are some changes necessary at the national level, at the state levels. There's inevitably going to be some new regulation, and there's going to be new best practices. And we hope to play a part in those best practices because we've got experience in that area. And I'm going to turn it over to Ron to give you a sense of what we're talking about when we say best practices, which really equates to resilience in commercial real estate. Ron?
Great, thanks, Mike. You want to build the slide for me? So increasingly, we're taking these buildings and we're bringing all kinds of new granular data to the fore. Temperature, occupancy, environmental monitoring, air quality, cleanliness, energy consumption, all of the granular pieces of data that make these buildings living, breathing entities, physical parts of our infrastructure. And increasingly with sustainability, how can I communicate to my customers, my partners, my investors that I'm reducing my carbon footprint or I'm saving the planet if I don't have the core data? How do I know that something's clean? How do I, just looking at it, visual inspection isn't good enough. And increasingly, regulators are pushing for real accountability. We're finding conversations in the C-suite around sustainability and ESG. And so already our business has been growing because clients are trying to take these physical structures and do things like maximize occupancy. Typically, real estate is one of the most expensive things on my balance sheet. And so is all my space being used properly? Am I getting all the efficiency out of it that I want? How am I doing at attracting and retaining millennials that come into my workspace? We've started to move towards shared workspace environments. And so already these changes were underway in the traditional brick and mortar world. Next slide. But now COVID-19 comes along, and this is going to put all of these questions into an accelerated mode. Landlords, tenants, workers are all worrying today. What am I going to do? If I own that building and I'm making a mortgage payment on it, I'm dependent on my tenants to make the rent. Increasingly, we've just broken the mold. So many of our clients are working from home for the very first time. Just last week, we had so many meetings that were postponed because senior executives are trying to figure out how to use Zoom. There was a very definitive line up until a few weeks ago. I go home to play and I go to work to work. And suddenly that line has just been decimated. And now all of a sudden we have all these empty buildings and empty factories. These buildings weren't designed to be mothballed. And so how are we going to think about not just getting through the crisis, but ramping them up? And how do we ramp them up? Are we going to go back to business as usual? We don't think so. We think that we've broken a paradigm now around flexible workspace, flexible work options that are probably going to be here to stay. There's also going to be lots of regulatory questions about this, especially around ESG, carbon footprint. People are going to start to rethink ROI on rent. Is renting that much space really make sense? What's the impact going to be on our productivity as we're going through this shift? Suddenly, typically, real estate is one of the most expensive lines on my balance sheet. And so now, am I going to just go back to business as usual? We're not sure. And then reputation, liability, and ESG matter. People are watching as companies like GM shut down factories. Large inner city complexes are powering down. And so people want to know how are companies going to navigate these new and uncharted territories? And all this has just come into being in the last 20 days. Our core technology brings these buildings to life, but it also monitors them on a real second by second basis. And they're producing data. And with that data, I can begin to track and monitor all kinds of things. One of our clients last year said something that stuck with us, and we use it often. It's so simple, it's so elegant, and it's so right. Occupancy equals dust. Spaces that get used by us, by people, are the spaces that need to be maintained more, need to be cleaned more, need to be monitored more. If space isn't being used, why are we spending resources and time worrying about it? Today, without being able to measure occupancy at a granular level, I treat all space the same. And suddenly my ability to start aligning my resources, aligning my effort with occupancy to make sure that it's getting cleaned more frequently, that bathroom supplies are there, that leak detection is happening, that air quality is being monitored, where people are showing up and doing their work. That's the big alignment that we're able to do. We do this with these low power sensors that you see pictured here on this slide. This is where the LoRa Alliance comes in that we talked about at the beginning. LoRa, these low power sensors, many of them are now under $20 with a 5-year battery life. And those sensors married with cloud infrastructure providers like Amazon and Microsoft and the Microshare software platform suddenly allow me to come into space like this floor plan that you see and very cost effectively begin to capture all this data. Just 2 and 3 years ago, most of this wasn't possible. The cost was just too expensive. The invasion was too expensive. I didn't have battery powered. I needed to get power to these sensors. So what happened? Nobody did it. Now all of a sudden, we have the ability to start sensoring up all of this space, digitally twinning it. And with the data of that digitally twin, begin moving to preventive cleaning solutions, tracking behavior in bathrooms, looking for patterns in disease and infection. All of these things become possible while at the same time, and this is so powerful from a business pickup perspective, reducing costs. So we're improving the quality, improving the cleanliness, improving the customer satisfaction, and we're able to do it for a fraction of what you could have done just 24 months ago. Mike?
I'd like to jump in and talk a little bit about some of the things that a building produces, which we have yet to harness in most cases. There are 3 real categories here. There's the one that most people know of. It's efficiency, building performance metrics, and cost savings. ESG, which we've mentioned several times, it's environment, social, and governance data. That is a new kind of standard that's being propagated in the EU, I know, by regulatory means. And in the United States, by very powerful market forces that are pushing companies to be more resilient. You probably saw the announcements last year from players like BlackRock and Walmart about their adherence to ESG and their determination to get better at it. And then there is health, safety, and wellness. And that's really, I think, where the rubber meets the road right now in the current business environment. I want to take you through a couple of the things that relate to these three categories. First of all, the efficiency play, as you know, is something that is ever present in business. No one wants to be seen as inefficient, whether it's the investor looking at you, whether it's your employees, or whether it's your boss. Inefficiency in the best of times is wasted money on rent, energy, contractors, et cetera, et cetera, et cetera. And our particular solutions not only give you some visibility into this, but the minute they start going live, and they go live almost as soon as you put them on the wall, and that's a very cost-effective thing, you see these things in real time, and the data is collected and it's auditable, and it creates actionable insights very quickly. The second benefit, of course, ESG, and in Europe, corporate social responsibility might be the more current term. There's an interesting coincidence about the efficiency category. Almost everything you would do in terms of IoT data, sensors, and the kind of integration and dashboards that Microshare creates overlaps with ESG reporting. On the right here, you see a chart that we created that has some of the major ESG metrics that are being required. And ultimately, you see that many of them are exactly in the wheelhouse of efficiency. So not only will you save money, but you will be able to then monitor your energy efficiency, your water usage, the stakeholder engagement, which we have feedback sensors, which are really powerful and morale boosters in many cases, workforce health and safety, obviously, and ESG reporting standards. These are all things that you will need to collect in a large corporation these days. Many corporations, and many in financial services, for instance, they hire somebody called an ESG engagement officer. These people go to board meetings if they're invested in a company to ask tough questions of the CEO about ESG issues. But Morgan Stanley, which has been leading in financial services on this, did a study that estimated 80% of these folks who are fairly well paid are spending their time gathering the data that could be fed automatically into a dashboard by a sensor. That frees them up to do a lot more useful work. And it maybe means you don't need as many of them too. But ultimately, ESG and CSR reporting are a second benefit here. Third, and this is really what we're talking about today, there is a premium on retaining talent today in the economy. Even in this downturn, people realize that whatever new reality we return to, it probably will include the need to keep the best and brightest of the employees you had. You certainly, if you're a landlord, or if you are a residential landlord, you have tenants, you have customers that you want to make feel safe. We're going through something that completely reshapes our sense of space, our sense of what is safe and what is not. The idea that people will just flow, casually back into a large office building without thinking twice about how close their cubicle is to somebody else. Those are no longer realistic things. We need to bring some reassurance. And in our thinking, this means that people who own buildings, manage buildings, invest in buildings need to insist that some proactive steps are taken. Any building of any age can produce data, and they weren't built to produce data, but luckily the sensors we're talking about are very simple to install by non-professional staff, and they as we've said ad nauseum so far, with the cleaning efficiency, waste management, air quality, energy usage, etc. These are things that are tremendously valuable from several standpoints. All three of these categories you can deal with our solutions. Ron, we have this enormous kind of platform of potential solutions. A lot of these things work together to create kind of specialized suites of capability. There are also other things we do, which we develop. Many of these things we've actually developed from scratch with partners. And so ultimately what we want to do is look at each use case, each building or portfolio of a building's necessities, and figure out what in this mix of capabilities we can bring to the table. And if the capability doesn't exist, we have the partnerships and we have the capability internally to develop that use case if it's possible. The idea here, of course, is when we talk about the predictive cleaning, for instance, is you get on top of things, you get ahead of things. This is a real example of something we did in a large hospital. This was that little sensor you see on the bottom left is telling people what is needed. This is also available in a touch-free, QR code form as well, which is another thing that's very current, obviously. But ultimately, we found that there was a lot of response to this, and that if you look at some of the things here, how relevant this is. Soap is needed. Toilet paper is clogged. Toilet is clogged or broken. These are all potential sources of infection. Leaks. These are the kind of things you really need to know if you're going to run a building that is optimally equipped to avoid spreading infection and making your tenants or workforce sick. So I will turn this over to Ron now, who's going to take us through some of the nitty-gritty of the healthcare facilities, which have been in the lead of this, the vanguard of this movement in many ways, because it is so important to them, and they've got a very specific problem with antibiotic-resistant viruses. Go ahead, Ron.
Thanks, Mike. So as we said earlier, we started working with hospitals several years ago, and we begun to understand some of the challenges specific to the healthcare system. As you can see, antibiotic resistance viruses, 2.5 billion, and that was in 2019. We're obviously going to see changes in that. Also, the number of patients that get infected at the hospital has been an ongoing problem. So keeping the hospitals clean and sterile as we matriculate patients through. Monitoring the water supplies in healthcare for things like Legionella disease. All of these things are manually done and very expensive, as well as monitoring refrigeration. So blood is stored in refrigerators, and registered nurses need to check that temperature manually on a regular basis. And again, if any of these systems go wrong, the cost is not just dollars and cents, but sometimes lives as well. So it matters. And within a hospital environment, next slide, within a hospital environment, or virtually any, but hospitals as well, there's so many sources of contagion, virtually everywhere you go. So everything from using the bathrooms, touching any of the equipment, everyday interactions with patients and employees, transporting within the hospital in elevators and others, common areas, listening to some of the reports coming out of Italy, 30 and 40% of staff members are infected as well. So within the hospital, how do we keep track of, and how do we monitor real cleanliness, real process as we are trying to matriculate these patients through? Next slide, please. So there's really two primary buckets that we think about these solutions for hospitals. One is this whole move towards predictive cleaning. Can I be cleaning, again, going back to occupancy equals dust as a simple explanation? Can I put all my resources around exactly what parts of the hospital are being used on a regular basis, and aligning my cleaning and my sterilization efforts and my reporting and my audit trail efforts with all of that activity? And the other thing that's very prevalent in hospitals, and we're one of the first companies to be doing this at scale, at a disruptive price, is asset tracking. Knowing where stuff is in a hospital matters a lot. And I'm going to talk more about that in a minute. So next slide, please. So, some of the work that we've done in UK, infection prevention, So looking at simple things like the temperature in the waters, temperature in all the filter systems, looking at all of the ecosystems around air quality. All of these things combine to look for airborne viruses, to look for patterns that suggest that something is moving and beginning to affect other patients. In patient care themselves, right? So it turns out that your relationship to your bed is more important than your relationship to your room. Your bed gets used to transport you to all different departments within the hospital. And sometimes the bed gets mismatched. The bed is very important because whatever happened to the patient in that bed before you dictates exactly how that bed needs to be treated before there's a new patient. So being able to align the physical assets in the hospital with patient care is a major opportunity and improvement. And then we touched on productivity a little bit, wirelessly monitoring the temperature of blood refrigerators, for example, a way to lower cost, wirelessly monitoring Legionella reporting and water quality and monitoring for leaks are all big wins for hospitals as they are churning through so many patients. Next slide, please. As I talked about earlier, we have an internal audit asset tracking solution for hospitals, primarily around hospital beds, wheelchairs, et cetera. It's not only important that you know where your assets are, it's important that you can create a real-time audit trail all the time to know where are those infusion machines, where were they? Were they at the right place at the right time? And so being able to free up staff from looking for lost internal inventory, which happens so frequently in large hospitals, much more than we imagined when we first started. And so the ability to drive asset tracking has a huge impact on the quality of people's work and the level of care that they can make available. So next slide, please. So specifically within asset tracking, we talked about bed tracking, having a complete audit trail of where that bed's been, making sure that it's got the right level of treatment, the right level of sterilization for turnover. For wheelchair tracking, patients can't leave a hospital without a wheelchair. It's just the rules. Departments know that wheelchairs are in short supply, so they hoard them. We've gone into so many hospitals, it turns out maternity is one of the biggest culprits. But they're hoarding and hiding wheelchairs because they need to get their patients out. That's the only way they're going to get new patients in. Think about the volume that is hitting the hospital infrastructure now with this virus and what the next several months are going to mean, and how important it is to know that I need wheelchairs to move these patients out to bring new patients in. And then finally, key asset tracking, infusion machines, blood pressure machines, very expensive assets. One, I need them right now for the patient, but there's another big problem. These assets are expensive, they're valuable, and they walk out the door because they're all designed to be portable. So how do I, one, know where they are, and two, make sure that people don't walk out the door with them? So big wins for a lot of our hospitals. So we talk about cleanliness, we talk about using these sensors to monitor. Mike showed you some of the things about need soap, water, water's leaking, etc. These push buttons are at the tip of the spear for a lot of the solutions that we provide, and they can be used for so many things. What's really cool about these is that if you push the button that says, this space needs to be cleaned, when a cleaner shows up, they have a small magnet on their keychain and they tap the bottom. And so now we have registered the time that the request was made. We have registered the time that somebody showed up to actually perform the task. And when they're done, they tap it again. And so we have a complete audit trail of frequency of how the facility is being used and how it's being responded to. So we combine this sensor with an occupancy sensor. Suddenly I know how many people walked in and out of the bathroom. I also know then when somebody complained about a water leak or toilet paper or soap, exactly when somebody showed up to replenish or to clean or to mop the floor. All of these things become important. There's something called SLAs, service level agreements, contracts increasingly to take care of, clean, and maintain hospitals are being built around service level agreements. How do I know that the people that I have hired to clean the hospital are doing a good job? All of this data that didn't exist before, all of this data gives me a very granular, factual answer of exactly how that bathroom's behaving. We have another sensor right now that picks up the fumes of hand sanitizer soaps. And so suddenly I can start tracking how many people are coming in and out of the bathroom. What's the soap consumption in that bathroom? That becomes interesting. Is that soap consumption average with other bathrooms? Is it more? Is it less? If it's less, I can take proactive action, putting more signs, more notices, reminding people to clean their hands. I also know when the soap is empty. So the ability to immediately replenish that soap. Also, when I'm looking at all the trends in bathrooms, and now I have a standard, I know that in the bathrooms in my hospital are being used at a particular level of behavior. If I see spikes, if I see anomalies, I suddenly have an insight that maybe something's happening. Maybe there's another virus going around. Maybe there's another illness. We had a client that works with a very fixed population, and the medical staff at that client was keenly interested in the occupancy sensors in the bathrooms because they could use the data there to see an early indication that a new stomach virus or a new airborne virus was becoming available. And it suddenly gave them 3-4 days notice that they never had before. So something as benign and simple as bathroom sensors, simple push buttons, suddenly give you a digital audit trail and a digital body of data to create all kinds of new insights and opportunities. Oh, by the way, these push buttons are infinitely programmable. So we have one client in the UK that is putting a single push button in exam rooms for potential virus patients. If a patient tests positive, they push the button and it indicates it requires a special kind of cleaning before the next patient comes in. And so it's a single push button where the staff's requesting that this room be prepared for the next patient. The cleaners show up, they tap in, they tap out. That's a single purpose for the same set of buttons for need soap. By the way, we put them in conference rooms and say, hey, I need help with getting the audio visual to work, or hey, please come and empty the trash cans. So anything that you can think about with real-time consumer feedback. We have a hospital chain in the US, they're thinking about putting these buttons in with the patient, putting one with each hospital bed. What 3 or 5 buttons might you want to put for a patient so that they feel like they're being heard, that they can request special services, that they don't need to call the nurse to then ask for a glass of water. Maybe they can just push the button and directly place that order. So there's all kinds of creative use cases combining these environmental sensors, these people counting sensors, and these feedback sensors that give you all kinds of unique capabilities in this time where it matters to understand occupancy equals dust. How do I make sure that I'm cleaning and maintaining everything at the right time? Next slide, please.
Ron, before we move, I just wanted to mention one other really relevant and exciting thing that we're developing for a hospital client in Europe, which is a single button that would be used if any room were determined to be occupied by somebody who is positive for COVID-19. That would prompt a series of steps within the hospital, including a deep clean of that area. So, I mean, this is stuff that is because of the low cost and the efficiency of it, is being adapted very quickly to the current business environment. Here's the next slide.
Thanks. So the goal is to remove the complexity and figure out how we can get more efficient. We all know that the number of hospital beds globally, there's just not enough to service what's happening right now. I don't think that life's going to go back to normal. I think there's an awareness now of how these viruses can affect all of us. Bill Gates wrote a wonderful piece that's going around the internet over the last couple of days. You know, this virus doesn't discriminate against your economic status, what country you're from, your religious orientation. It's a great equalizer that reminds us that we're all one planet. And we need to figure out how to get much more efficient with the healthcare infrastructure that we have, because this is the new reality moving forward. So being able to monitor your space real time, occupancy equals dust, being able to track your assets internally, being able to weave in that real time feedback, that real time communication with your patients, your suppliers, your doctors, whoever it may be, being able to recognize patterns early and often that allow us to get ahead of the spread of these infections, as opposed to just reacting, which is where we are right now. And then ultimately, just the icing on the cake, these capabilities reduce costs. We're not coming into a hospital, we're not coming into environments saying, spend more money. There's a solid ROI on here that's dollars and cents based, let alone the ROI of saving lives. So with that, I think that's the last slide.
Yeah, that's right, Ron. We've got some questions lined up. I want to remind folks to pose any questions you have for Ron and I in the chat feature. We have a producer waiting eagerly to pass them on to me. We've got about 4 of them so far. And so let me start with this one. This is Ian. He doesn't want to be identified by company. The hospital in Northern England, I assume that's an NHS facility. We can't confirm that, Ian. Have you done this in other hospitals too? Ron, do you want to take that?
Yeah, absolutely. So we have done it now in a couple hospitals in the UK. And in the last few weeks, several hospitals have come to us and asked for proposals in the same area. We're not selling directly to the hospitals. This may help clarify. We are working through the facilities management companies. They take care of these hospitals. And the beauty of that is they've already got the relationship, they've already got the procurement and the infrastructure in place, and they're the feet on the ground who are responsible for cleaning and maintaining these facilities. So the initial use case is in Northern UK, but we've got several more now unfolding as we speak.
Okay, another question. This is from Ian in Bristol. I guess that could be Connecticut or England, or Maine. Can you expand a bit on ESG in Europe? So obviously it's Europe. In Europe, we don't really use that term, but I know it's the common usage in the US and in the financial services world. How does IoT help there? Maybe I should take that one, Ron.
Sure.
So ESG, environment, social, and governance, has been a dream really for a decade or so. And in many ways, it was driven early on by so-called impact investors, these folks who have large funds who go into a company and say, listen, we will give you X amount of money if you take these steps. It's intimately tied into the UN principles on development. There's a very robust infrastructure both in the US and Asia and Europe now of groups that kind of police this. There's an entire industry of people like MSCI, Thomson Reuters, and others who look at companies and they have very different methodologies and often come up with very different ratings, but they rate companies based on their ESG performance. And ultimately that is used by funds and index funds that hope to, push people toward ESG positive groups to rate whether or not a company is qualified for investment. So it's pretty big deal. One of the groups that has driven this, Larry Fink at BlackRock for the past 2 years has made a very public point in his letter to investors that he's going to, essentially emphasize this in investment decisions, in acquisition decisions. The Conference Board, which in the United States is a grouping of some of the most powerful companies in the country, joined in essentially this year, saying that it's no longer. I mean, it was a real revolutionary statement. I mean, and there have been questions about whether or not some of this is marketing, but what they basically said was, it's no longer enough to serve the interest of the shareholder. We also need to consider society. And so that's what ESG really is. And from the standpoint of what we do at Microshare, as I mentioned, there's a lot of overlap in what we do in the metrics that are necessary to prove that your company is either performing or not performing in an optimal way on ESG measurements. These are going to become more and more important to corporations. If you want to think of an analogy, imagine Moody's or S&P downgrading you. Of course, in the past, that would be about debt and some other issues, maybe revenue. But now we're also adding to things like the way you treat your employees, whether you have gender mix in your boards, your energy efficiency, your waste management practices, all of these things, and carbon footprint, of course, all of these things now become much more important. And the direction is clearly in going toward a much more stringent assessment of companies in that regard. And that includes portfolio real estate. So that, I think, should answer that question. We've got a couple more. Bernard in Miami asks, a question for Ron Rock. I want to commend you for the timing of this webinar. How is the downturn likely to affect your business and commercial real estate generally? That's a tough one, Ron.
Well, that's a great question. I've described to several investors and colleagues over the last few weeks as this unfolding. It really feels like the tale of two cities. We've had a lot of momentum in several industries around commercial real estate that have hit some speed bumps. They're not going away. It's just, people are learning for the first time how to work from home. People are learning. It amazes me the number of senior executives that have never used Zoom or GoToMeeting or Microsoft Teams before, Skype. So we have seen some disruption there. And also now that the buildings are empty, there's even real, I was just in a meeting this morning where questions are we allowed to go in and install the sensors right now? So people want to order the sensors, they want them ready, but there's obviously uncharted territory on that. The flip side, the other side of that story is that the healthcare focus and that the need for the kind of things we've just talked about right now, real time right now. Let's understand, where are people going in the hospital? What's being utilized? Are bathrooms clean enough? What are we doing to make sure that people don't come in with COVID-19 and walk out with 2 other problems? And so there's a very real uptick in that side of the business as well. So it's a balancing act, and we are all, day 22, day 23, wherever we are, it's early. And we still don't know what we don't know. But so far, that's been our experience.
Ron, I think this is another one for you. Neil in Orange County, California asks, can you tell me about asset tracking solutions a bit more? We have luggage carts and other materials in our residential portfolio. Would the system you described for wheelchairs work for those as well?
Yep. So we're using a combination of Bluetooth and LoRa technologies. It allows us to monitor in a floor plan. Interior works very well. Works a little bit on exterior depending on the use cases, but the combination of those two technologies. Our typical competition is RFID. RFID is very invasive. You got to put the infrastructure in place. It's expensive. The RFID requires that you're proactively scanning, so devices don't just sit there and await and recognize when an RFID item comes within its range. So there's some logistical process pieces that make it more complex. So what we've done is we've taken low-cost Bluetooth beacons. Some of them are as cheap as $5 and $6 with a 5-year battery life, and some of them are the size of a US quarter. Others are the size of a pack of cigarettes. And again, depending on the use case of the asset you're trying to track, it's attaching those beacons to, or those tags to the assets that are being tracked, and then putting in the proper LoRa and Bluetooth infrastructure to track them. A lot more detail to it than that. Please feel free to reach out to us and we can listen to what your use case is and give you our thoughts. Next question.
Next question is, there is a lot of talk right now about infections. What is the relevance of what you do? This is an anonymous question, by the way, to lowering infections in places that are not in hospital settings?
That's a great question. I think the same, we touched on that a little bit earlier in the presentation. Workplace health is going to be a big deal going forward. It wasn't one of the top 5 things that people talked about just 3 months ago. As people think about coming back to their workplace, what are employers going to do to make their employees feel comfortable, that they've got the environment under control, that they've got the bathrooms and the cafeteria under control, that they've got all of the right monitoring taking place to make sure that people don't come back to work and come down with something else. All the solutions that we talked about, our bread and butter, our pedigree was commercial real estate first. Then we started defining commercial real estate as hospitals but not touching the patient, and airports not touching the airplanes because they're regulated. And then you get into all kinds of more complex complications as far as getting those types of solutions installed. So yeah, I think that our solutions work great in non-hospital environments as well for all the same reasons.
It's a question from Rachel in New York. Rachel asks, I read a lot about IoT being an issue from a security standpoint. Is there something special you're doing to address that?
That's a great question, Rachel. So traditional IoT, dating back to 1999, had all kinds of very complex processing taking place at the edge, which meant that the sensors themselves sitting in a room were doing a lot of computing and a lot of analysis. And the problem with that is they were great targets for hackers. And we all remember the story where people hacked in through video cameras and got into the main accounting system of a major corporation. Why? Because those cameras were intelligent on the edge. The whole LoRa ecosystem that we talk about, the fastest growing IoT network in the world, the sensors here are very stupid. The sensors themselves don't even know where they are. They don't know what they're doing. So for example, imagine a temperature sensor just saying 70. That's all it knows. It doesn't know 70 what. It's not until that number 70 wrapped with some other tag specific data gets up into the cloud, and we're doing all of our processing, all of our intelligence up in the cloud. So now that means that we're riding on the coattails of Microsoft Azure or Amazon AWS with all of their encryption in transit, storage, all of the security infrastructure around that. So it's very difficult to hack these low power sensors. They're encrypted and they're packed data. But if you did successfully hack it, and so far that hasn't happened, but if you did, the data that you got would not give you any relevant insight. You wouldn't know what it is. And most importantly, none of these sensors are connected to the corporate network. So there is no data there that's really worth anything to the hackers. So that has been why this is the fastest growing IoT network in the world. Tata has just wired up India to provide these kinds of sensors throughout that country. We've got Vodafone doing it in Germany. We've got Orange doing it in France. And one of the primary drivers for it is the security.
Ron, I've got one more question queued up. This is from Philippe in Marseille. And Philippe asks, how can I put sensors in a bathroom? Wouldn't the tenants think that it's a camera?
That's a great question, Philippe.
It sure is.
We just published a white paper. I think it went on the wire about 2 weeks ago. We've learned so many best practices about how to install these things in an environment. You know, the technology is great, but technology doesn't solve a business problem. You've got to be able to get buy-in from your customers, your employees, your management, the board, and everybody has to feel comfortable. And some of these sensors, even though they're very inexpensive, they have a little bubble on the side that looks like a camera. And it's not, but it can easily be confused as such. We've developed a whole catalog of best practices on how to create awareness, how to start, what sensors you should start with, how you set up show and tell in the cafeteria a couple weeks before you actually begin to deploy. You let people touch and feel the sensors, pick them up, you talk to them about it. So there's a whole series of internal communications. We've also got some videos on our website, and we've developed a growing catalog of the non-technical important factors for a successful IoT implementation. And what we're learning, if you communicate it right, people understand this is where the world's going. People understand the value. As a matter of fact, they even get excited that their company cares enough that they're doing this. So there's a whole lot of win and a whole lot of halo effect that comes out of it, but you absolutely have to do it right, or it will backfire and cause you 6 to 9 months of disruptive pain.
Well, Ron, we currently have no further questions. We're getting very close to the end of the hour. It's now 54 past or 6.
Hey, Mike.
Yes.
Hey, Mike. With a few minutes left, on the Zoom webinar chat, a few questions have popped up for me as well.
Oh, go ahead.
With the wide adoption of sensors and collection of data, how do you pair data insights to provide actionable recommendations? Asked another way, how do you or your client avoid data paralysis? That's a really good question as well. There's so many levels of data analytics that we see available immediately and over time. I mean, ultimately, we'll probably all learn some very interesting things through machine learning, AI, big data analytics. But right now, what we're finding is that there's a lot of low-hanging fruit. And our experience with every client so far is that they fundamentally change the way they're thinking about what they want to do 6 to 8 weeks after seeing the data, because they've never seen it before. And so we take a very practical, tactical approach to helping our clients get started. Because we're running in Microsoft Azure, we're fully integrated in with Power BI. It's a very ubiquitous tool that companies have been using for a long time. So now it's just a new set of data. And so the combination of the tools that we use, the kind of data, and our experience is helping clients get those actionable insights, that real value out of the gate. Over time, I think there's opportunities for a lot more sophisticated data analytics. And you're absolutely right, Trent, who asked the question. that there is the opportunity then for it to slow down and for lots of opportunities to present themselves. But the immediate, because again, up until 24 months ago, none of this data was being captured at scale. So the low-hanging fruit on this is immense, and all the ROI that customers are looking for are in that, and then it can only get better from there. So we're very much aligned with helping folks get started quickly. I have another one. Can you discuss at a high level your pricing model and subscription cost around Microshare IoT solutions? Realize lots of parameters and costs decrease with volume. We have a really simple pricing policy. It's per sensor per month. It's a sensing as a service. There are no added costs. You don't have to pay extra for communication. You don't pay extra for software. Everything works out of the box. As we install our sensors, you're seeing the data live on your phone. And we've taken all the complexity, and believe me, there's a lot of complexity under the covers. The analogy I use is buying a car. Lots of people in the marketplace are still selling camshafts and brakes and carburetors or fuel injection systems, and we're just selling a car. Would you like a red one or a black one? And that's the kind of packaging that we've done. And imagine leasing your car. That's the same way that you're buying Microshare. It can get to be very inexpensive. The two drivers for discounts, how many sensors are you buying, and what's your commitment, anywhere from 12 months to 60 months. So we try to keep it simple. Thank you for that question. From somebody else, they said, are you comfortable that Microshare has the quote unquote jump on the competition with sensor utilization and other companies will not overtake you as a leader in this field? That's a great question. We've learned a lot in the last 5 years. We like to lament at times that we have made thousands of mistakes. And we're confident that all of our competition is going to make those same mistakes. We also are solving something unique. Microshare is solving how to do sensors at scale. It's one thing to put 100 sensors in a building. It's another to put 100,000 sensors in a building. And when I have 100,000 sensors, all with batteries, I have a new infrastructure, logistics, management challenge I didn't have before. So how do I install that many sensors? How do I replace sensors that have gone defective? How do I ensure that they're all communicating effectively? We've built a series of applications. We've got apps up on the iOS and Android store that allow our customers to quickly scan, rip and replace sensors. We've put a lot of energy around all kinds of utilization features to allow our customers to deploy at scale. We have a very robust roadmap of where we're going in the future, but we feel very good right now that we're ahead of the competition. We get that validated on a regular basis by folks like Microsoft and Arrow and other partners. So absolutely, a lot of people are going to jump into this space. It's a huge opportunity. We think we're in a good position to at least stay the course.
Ron, we're right at the top of the hour. I think we're going to wrap it up now. I wanted to thank everybody for being patient and for listening to us. Ron, thank you for your time.
Thank you, Mike, and thank you everybody for your time in these precarious circumstances. So we really appreciate you paying attention, and we expect to have some exciting updates in the next few weeks, and probably going to do a double click on this topic and have another webinar. So please stay tuned for that.
And we will send a recording of this one out as soon as we get it produced. Thanks, everybody, and have a great, safe day.
Stay healthy. Bye-bye.